Officials now working to sequence all COVID-19 tests that come back positive so they know what variant it is. This is Omicron, still has many people worried. News 9's Erica Rankin has a look at the important work.
So far, the Omicron variant has been found in over a dozen states in the U.S., including states that border Oklahoma like Missouri and Colorado. But state health officials say it has not been identified in Oklahoma, according to sequencing done at the state's public health lab.
We have sequenced over 9,000 specimens for COVID-19, and our laboratory is continuing to sequence on a weekly basis.
Julianne Stone, the state's epidemiologist, says of those, 0 have been identified as the Omicron variant. But Stone says there is specific criteria a test must meet to be eligible for sequencing.
Only those cases that are confirmed or have PCR that's done is actually even eligible to be sequenced.
Right now, hospitals and labs across the state are required to send in 10% of their positive specimens.
Once that is identified, that when the run is done on each of those sequencing processes, those results get notified to our acute disease service. And we look at those as soon as we get those results. Our laboratorians are looking at those as well.
So Stone says they will be able to quickly identify if the Omicron variant is in the state.
Certainly the commissioner, the governor will be notified, and CDC has asked that each state notify them as soon as the first case of Omicron is identified within their state.
Stone says they are urging hospitals and labs across the state to continually send them as many tests as they can that can be sequenced to catch the Omicron variant if and when it makes its way into the state. In the newsroom, Erica Rankin, Oklahoma's own News 9.